Hi, I'm Abby Roth, a midwife here at Albany OBGYN. You've made it to the home stretch of your pregnancy, which is super exciting. Hopefully you've taken the opportunity to independently explore some virtual childbirth prep and breastfeeding education resources to prepare for labor, birth, and feeding. In this video, I'll help you to decide what to pack in your bags, how to know when labor truly starts, what to expect upon arrival to the labor and delivery unit, some pain management options once you are there, and a brief discussion of your birth plans and our birth standards of care that we collectively practice as a group of midwives. When packing bags, keep in mind that your birth partner should have a bag of their own, and to include a few things for baby, but also remember you guys are not moving in. Some common useful items include a Bluetooth speaker, some music, maybe some essential oils to make the labor room feel like home, toiletries of course, chapstick and lip balm, flip-flops or shower shoes, 2 to 3 outfits each, including some nursing tanks, bras, pajamas with loose-fitting, comfortable pants, large cotton underpants, socks, phone or camera, chargers, and your wallets with insurance cards and IDs. The hospital will provide mesh underwear, pads, and peri bottles for you. For your baby, you can consider maybe 2 to 3 outfits, swaddles, a seasonally appropriate going home outfit, and you can bring your car seat into the hospital if you choose, or you may leave it in the car. The only time you would need the car seat in the hospital with you is if you're expecting to give birth to a baby that's less than 5 pounds, or in the unlikely event that your baby is born prematurely. The hospital will provide for your baby some t-shirts, swaddling blankets, diapers, and wipes. And we recommend that all of your bags be packed at or around the 36-week mark, so that when labor does begin, all you have to do is grab and go. I frequently get asked, when should I call when my water breaks? How will I know if I'm in labor? So more often than not, in fact more than 90% of the time, contractions begin before your water even breaks. So usually labor begins with some mild contractions that are in the lower abdomen and or around the lower back, which can feel very similar to menstrual cramps. These cramps may be associated with some tightening in the uterus, which relaxes as the cramp goes away. A gradual progression from these cramps that are often times irregular in nature will occur throughout the day or night. And then your contractions will increase in not only intensity, but duration and frequency as well. Generally, as a practice, we recommend calling your midwife, which is the office number day or night, when your contractions are occurring every 5 minutes, so from the beginning of one to the beginning of the next. They're lasting 1 minute each, and this has been consistent for at least 1 hour. Remember the rule 511. Sometimes labor apps can be helpful in timing your contractions, but I always want you to be mindful of what your body is telling you, right? So once you've called and spoken with the midwife or nurse, and the plan has been made to head into the hospital, she can tell you the best place to park depending on the time of day or night. You can always feel free to use the hospital valet service for your convenience, which is great. Upon arrival to the labor and delivery unit, you can expect a cervical exam to determine dilation and to diagnose your labor. It's generally recommended that cervical dilation of 4 centimeters or more and actively laboring upon admission reduces interventions such as early epidural and therefore the cascade of events like IV Pitocin or artificial rupture of your membranes for augmentation of labor, with ultimately the risk of increased risk of cesarean. So, whether or not you're planning for an epidural for your labor, there are a variety of pain management options for each stage of your labor. In early labor, which is best done at home anyway, we recommend frequent position changes such as walking around, sitting on a birthing ball, using a peanut ball that we have available at the hospital, hands and knees, forward leaning, side lying, have a shower or a warm bath, snacking and hydration for comfort measures. Once you're at the hospital, IV medications are available for that early stage of labor. So these medications are narcotics, and they do pass briefly to your baby. So that's why we use them only in the early stage of labor to minimize the risk of effects of narcotics to your baby when he or she is born. The medication's effects are typically gone after an hour of administration to mom. So then when you are in active labor, St. Peter's Hospital does have inflatable hydrotherapy pools for labor. And then if you're planning an epidural, you're usually ready by now. We save the hydrotherapy pools and epidural for active labor as to avoid slowing down or stalling your labor, which could ultimately lead to those unnecessary interventions. If you have developed a birth plan or birth wish list, if you will, be sure to provide your nurse with that documentation upon admission so that we can all support you. If you haven't formulated a formal document, that's okay too, right? So whatever works for your family. So let's review first that St. Peter's Hospital is a baby-friendly designated hospital, which is a recognition from the World Health Organization and UNICEF. So in short, this means that many items on your wish list may be what are called standards of care. So as long as we're not expecting for your baby to need any specialized care at the time of birth, your baby can be placed right directly skin to skin with you on your belly or chest. So then we routinely allow for the cord to cease pulsing, which is also called delayed cord clamping, prior to cutting it. So your baby can then remain skin to skin for at least an hour for that first golden hour after birth. All immediate and future procedures, such as the erythromycin eye ointment and vitamin K shot, which are Department of Health mandated, and then those assessments can be delayed for that first hour and would always be done by your nurse while your baby's breastfeeding or skin to skin with you, if that's your preference. St. Peter's also supports rooming in with your baby, so you never have to be separated from them, which helps you and your partner to get to know your baby's feeding cues and also facilitate bonding for your new family unit. So I hope you found this video useful and helpful for preparing for the hospital.